wonder why we were asked to smile in photos? Well, because people usually look their best and their happiest when smiling. But for those with periodontal disease, smiling may be difficult, maybe even embarrassing. But in addition to missing the outward benefits of smiling, people with periodontal disease may be suffering with internal oral infections affecting their overall health. Joining me today once again is board certified Dr. Harley Richards from Florida Dental Implants. Good morning.
Good morning. Good to see you.
So glad to have you back this morning. People watching this morning, people listening this morning, this is something we've talked about before. When your teeth, they're number one hurting, they look bad, it is life-changing. People stop what they're doing.
Well, they can. They may stop everything they're doing, particularly if they come down with an infection in a heart valve. So there are some definite medical conditions that are affected by oral disease, and so people who have poor oral hygiene or a mouthful of badly decayed teeth or periodontal disease may suffer from other ailments, or other medical conditions may be worsened by the oral infection.
But you say, you know what, go ahead, come on in. We've talked about people have anxiety, they have maybe fear of going to see the dentist, but it doesn't have to be that way.
No, it doesn't, because we do our procedures under general anesthesia. We have two nurse anesthetists, and these are highly trained nurses who put people to sleep under general anesthesia while the surgeon does their work. So to avoid fear and anxiety, we put you to sleep.
Well, and also to do that, you guys are doing the work that you're doing in one day.
In one day.
I mean, it's amazing to me. There are people I know who are waiting for new teeth or dentures for weeks, if not months. And if you have somebody who's got anxiety or fear, they're not going to wait that long.
Well, you're correct about that. We do some special techniques. One special technique that we do that enables us to do things in one day are called zygomatic implants. And we've incorporated zygomatic implants into our practice now since about 2005.
Okay.
And in Lakeland, in little old Lakeland, we do more zygomatic implants than anybody in the entire country.
No way.
And these have enabled us to do one-day procedures where other doctors require 18 to 20 months to complete the procedure in multiple stages.
Well, because we were talking about, I guess a lot of people may have to have a bone graft done, right? Which takes traditionally
a long time.
Months, yeah. But this is a way, what your team is doing, you can still get new teeth, a new smile in a day.
That's correct.
That's amazing. I know we're going to get to a testimonial right here, but I'm so excited to hear from you about the reactions of what this is doing to change people's lives. Let's go ahead and get to one testimonial.
My consultations with other dentists was that bone grafting was going to have to be performed, and that would make a very long and detailed ordeal. The experience on the new teeth now was fabulous. The fact that I could walk out that same day, have dinner that same night, just overwhelmed me. I wish I had had the new teeth done much earlier in my life. It would have eliminated a lot of pain and anguish that I experienced. I've never spent this kind of money on myself personally before, but it was an investment that I would do again. I can walk into a room, I feel confident, I can smile with the greatest, I can laugh with everybody, I do not have to hide my mouth. I can eat anything there is. I can eat an apple, corn on the cob, the toughest steak. Would I do it again? In a heartbeat.
Well, and do you hear that a lot? I wish I would have done it sooner.
We do hear that.
Yeah, I'm sure.
But it's all fear and anxiety.
Well, thank you so much for being here this morning. If someone's watching this morning and says, you know what, I want to do something about this, I may be ready, what's the best thing to do? Call
the number they see on the screen, and we have highly trained staff members who can educate you over the telephone and hopefully leave some of your fear and anxiety about your first visit.
Well, Doctor, again, thank you so much for being here this morning. We look forward to having you back.